Module 5, Unit 3A, Initial Workup for Infertility, Patient History, and Physical Examination. Initial workup for infertility, patient history, and physical examination. The initial workup for infertility involves a comprehensive approach that includes gathering a detailed patient history and performing a thorough physical examination. Both these steps are crucial in identifying potential causes of infertility in both male and female patients. Below are the key components of patient history and physical examination during the initial infertility evaluation. 1. Patient history. The patient history provides vital clues about possible underlying conditions affecting fertility. It typically includes a general health history. Age. Both partners' ages are essential as fertility declines with age, especially in women. Medical history. Chronic conditions like diabetes, hypertension, thyroid disorders, or previous surgeries, e.g., pelvic or testicular surgery, can affect fertility. Medications. Certain medications can affect fertility, including chemotherapy drugs, steroids, and some antidepressants. Both male and female patients should provide a full list of their current medications. Previous fertility history. Previous pregnancies, whether current or past, and any history of miscarriages or complications are important. B. Reproductive health. History. Menstrual history for female patients. A detailed menstrual history is essential, including age of menarche, regularity of cycles, and any history of irregular periods, heavy bleeding, or painful menstruation, dysmenorrhea. Previous contraceptive use. The history of contraceptive use can affect a couple's fertility. It is important to know how long they have been off contraception, as some methods, e.g., Depo-Provera, may take time to reverse their effects. Sexual history. The frequency of sexual intercourse, any pain during sex, dyspareunia, or history of sexually transmitted infections, STIs, should be reviewed. Unprotected intercourse for at least 1 year without pregnancy is usually considered for evaluation. Obstetric history. The history of any previous pregnancies, including outcomes and a history of miscarriage and preterm birth. C. Lifestyle and environmental factors, smoking, alcohol, and drug use. These can have a significant impact on fertility in both men and women. Tobacco use, alcohol consumption, and recreational drug use can all decrease fertility. Weight and exercise. Obesity or significant weight loss can affect hormone levels and ovulation. Both partners' BMI, body mass index, should be evaluated. Occupational and environmental exposures. Certain occupations or environmental factors, e.g., exposure to toxins, chemicals, or radiation, can affect fertility. D. Past surgical history. Female history. History of pelvic surgery, such as appendectomy, cesarean section, or tubal ligation, may affect fertility. Male history. Previous surgeries such as vasectomy, hernia repair, or testicular surgery may cause scarring or obstruction. If family history, genetic or hereditary conditions. Any known genetic disorders in the family, such as Turner syndrome, Klinefelter syndrome, or cystic fibrosis, can play a role in infertility. 2. Physical examination. A comprehensive physical exam helps identify potential physical causes of infertility. A. General physical examination, body mass index, BMI. Obesity or underweight conditions can interfere with hormone regulation and fertility. A thorough examination of the patient's weight and general health should be performed. General appearance. Look for any signs of systemic illness that may indicate a chronic condition that could affect fertility. B. Female physical examination, pelvic examination. This helps detect abnormalities such as ovarian cysts, fibroids, and endometriosis. The examination can also identify tenderness, which may indicate infection or other pelvic pathologies. Bimanual examination. This allows the physician to assess the size, shape, and mobility of the uterus and ovaries and feel for abnormalities such as ovarian masses or uterine fibroids. External genitalia inspection to check for signs of abnormal development such as clitoral enlargement, which could suggest androgen excess, or any signs of infection. Breast examination. Check for any abnormalities including discharge or asymmetry, which could indicate hormonal imbalance. C. Male physical examination. General inspection. Evaluate the overall health and look for physical signs of systemic disease that might affect fertility, e.g., signs of malnutrition, obesity. Genital examination. The male genital examination includes inspecting the penis and scrotum for abnormalities such as varicocele, enlarged veins in the scrotum, hydrocele, fluid around the testicle, or signs of infection or injury. Testicular examination. A thorough testicular exam is essential for checking the size and consistency of the testes. Small firm testes could indicate testicular failure or low sperm production. Enlarged or asymmetric testes may suggest the presence of conditions such as testicular cancer or varicocele. Vas deferens and epididymis. Check for any abnormalities such as blockages or infections. A lack of the vas deferens can indicate congenital absence, which is associated with cystic fibrosis. D. Hormonal and endocrine evaluation. For both male and female patients, hormonal imbalances can play a key role in infertility. Signs of endocrine disorders, e.g., hyperthyroidism, prolactinoma, should be looked for during the physical exam, especially if there are related symptoms such as hair loss, galactorrhea in women, or changes in skin texture. Conclusion. A thorough initial workup for infertility starts with a detailed patient history and comprehensive physical examination. By addressing both general and reproductive health concerns, as well as lifestyle and environmental factors, clinicians can narrow down the potential causes of infertility. Early identification of medical conditions or physical abnormalities allows for the selection of appropriate diagnostic tests and interventions, leading to more targeted fertility treatments for both men and women.